Guys, so my friend just had ACL surgery, so you know I had to get this video out quickly. These are the top 4 and the best exercises to do immediately post-op from your ACL surgery. So let's get going. All right, so this exercise you can actually have your brace off for. Make sure you're in a safe environment, either on the floor or on the bed. What we're gonna do is just squeeze our quad muscle. So post-surgery, this front thigh muscle, the quad, will turn off as a protective mechanism. And what you wanna do is start getting it activated again. So you're just gonna squeeze as much as you can. It's gonna be difficult. And give a 1 to 2 second hold at the top, just to really get that squeeze, get that muscle. So you wanna do about 3 times of 10 reps. So we'll go through a few more here. Really trying to drive the bottom of your knee down into the bed. And you can see the quad muscle kind of activating here. You probably won't see it quite as much. And one more. We are gonna go right into a progression of that last exercise, the quad squeeze, and work our way into a straight leg raise. This is a lot more difficult, so if you can't do it at first, that's okay. So for this one, the brace should probably be on at first. A lot of the time surgeons will lock your brace at a certain angle so it doesn't just let your knee bend really quickly. So make sure you have the brace on, but that it's unlocked at least 15 to 20 degrees, okay? So you are going to lay back and perform that first exercise, perform the quad squeeze, really get it as straight as you can, and try to lift your leg off the table. So again, you can do 3 sets of 10 to 15 of these guys. I'll do them with you here. But what we're really working on is avoiding an extension lag. That's what that will look like. So you won't be able to fully lock out quite at first, so it's gonna have a little bend and then a straighten, but that's okay. That's what we're trying to get rid of, so that's what we're working on here. So really squeeze and lift. Doesn't have to go very high. The point is to keep that knee as straight as possible. Let's do 2 more here. Squeeze and lift. And last one, squeeze and lift. And then try that for 2 more sets. I know you're in pain after your ACL surgery. It is my mission on this channel to help you live a pain-free life. And a great way to do that is to try this next exercise. So this is going to be a heel slide. Here's where you are gonna actively try to start bending your knee. All right, so what's really helpful is using a towel. So if you're on a slippery floor, a towel is gonna be best. If you're on your bed, maybe a magazine is gonna be best, so it slides on that bed comforter. So put your foot on the towel or the magazine, and again, this one you can have the brace off for. Either take the brace off or unlock it to where your knee can bend, otherwise it's just gonna stop you. So from here, you're just going to slowly bend that knee as much as you can. You will not be able to do it a lot at first, and that's okay. It's just the beginning. You'll notice as you do more and more, it's gonna get better. So just like the other ones, you're gonna do 3 sets of 10. So we'll go through a few more together here. Slowly is perfectly fine, and you do not have to go very high. You can try to do a little bit more each time, just to really get that knee bent, get those muscles going. We're gonna get 1 more here together. Great job. Now we are going to go after that tight calf muscle. When you don't stand or walk as much as you used to, your calf is inevitably going to get a little bit tighter. So what you can do in a seated position is take a stretching strap. I have this one here. You can also use a belt or a dog leash if you are a fellow dog lover like myself. So you are going to bring the stretching strap around the ball of your foot. Make sure not to put it too low. You won't have as much leverage here. So keep it around right at the ball of your foot, and you are just gonna pull your toes up. Pull them towards you, and I feel a great calf stretch going on. You're gonna hold this for 5 seconds and then relax. And just like some of the other exercises, you don't really need your brace for this one if you have a brace, and so you can just leave it off because we're not really doing much with the knee here. So I'm on number 3 here. Hold for 5 seconds, and you're gonna go through 5 times. Okay, one more together. I've had this surgery. I know what it's like and I know how it feels. The best thing that I learned is the more you put in, the more you're gonna get out. So try these exercises 3, 4, 5 times a day to get those muscles activated and also get them stretched out so you can return to what you love doing. But don't go crazy. There are people out there, I'm looking at you. If you're doing it 100 times a day, you're going too far, okay? Don't do that. Stay tuned for my next video where I'm going to explain the anatomy of the knee and what happens when you tear your ACL. If you found this video to be helpful, please like, subscribe, and share because it really helps me out. Until next time, peace.